Hi, in this episode we'll be discussing rosacea. Rosacea is a common facial rash of unknown cause. It is typically chronic and persistent, and commonly starts between the ages of 30 and 60 years old. Although rosacea can affect anyone, it is much more common in those with fair skin. What exactly causes rosacea? The exact cause of rosacea is unknown, however it is thought that your genetics play a role in developing the disease. It is also thought that microbes may play a part in developing rosacea. Demodex follicularum is a mite that usually lives on the skin of healthy people in hair follicles and is not considered pathogenic. However, it is found in high concentrations on the face of those with rosacea, and so it's thought that this mite may play a role in developing rosacea. So what are the symptoms of rosacea? Rosacea causes changes to the skin, most commonly affecting the cheeks and nose. It causes red, inflammatory papules and pustules on the face. Telangiectasia is another common symptom of rosacea. It's where small blood vessels in the skin become dilated, causing a web-like appearance of redness on the skin. Rosacea can also cause thickening of the skin due to repeated inflammation. This thickening and scarring is known as fibrosis, and most commonly affects the nose in rosacea. Rosacea can lead to complications such as blepharitis, which is where the inside of the eyelids become inflamed. This leads to sore, itchy eyes with a gritty sensation. Conjunctivitis, which is an infection of the eye, is another potential complication of rosacea. Rosacea can also cause rhinophyma, which is where the nose becomes large, red, bumpy and bullous, and is a fairly common complication of rosacea. Rosacea is a clinical diagnosis. There are some important differentials to consider, including acne, systemic lupus erythematosus, dermatomyositis, eczema, and seborrheic dermatitis, as well as many others. Rosacea can't be cured, but treatments can help control the symptoms. Many people with rosacea get flare-ups of the condition when exposed to certain triggers. Triggers can include things like spicy foods, alcohol, hot drinks, sunlight, and stress. Patients are encouraged to keep a symptoms diary to try and detect things that may have triggered their flare-up. This then allows patients to avoid certain triggers. Patients with rosacea are given general skincare advice such as to apply sunscreen and to avoid long exposures in the sun, and to use moisturizers on the skin when the skin is dry. This helps reduce redness of the skin in rosacea. NICE guidelines suggest using topical brimonidine gel in patients with rosacea who experience persistent flushing of redness of the skin. Brimonidine gel works by constricting blood vessels in the skin, therefore reducing redness and flushing. For papules and pustules, NICE recommends topical ivermectin, which is an antiparasitic drug. It's not known exactly how it works in rosacea, however it's thought that it may have anti-inflammatory effects. For more severe papules and pustules, a combination of topical ivermectin as well as oral doxycycline can be used. Laser therapy is a specialist treatment option that can be used for patients with persistent telangiectasia. It works by heating and damaging the small blood vessels in the skin, therefore reducing telangiectasia. Overall, rosacea is a chronic condition that requires long-term treatment. Although it can't be cured, it can be controlled with treatments and by avoiding triggers.